I naturally have hooded eyes that are getting worse with age. Some people say Botox can help open up my eyes, but others say it can make hooded eyelids even worse. Which is true? Well, both statements are true. And understanding why requires knowing the biomechanical relationship between your forehead and your eyelids. The frontalis muscle, which is the forehead muscle, lifts your eyebrows. In patients with hooded lids or dermatolysis, excess upper eyelid skin, the frontalis works overtime. It compensates for the weight of the drooping tissue by chronically contracting to hold your eyebrows elevated. This constant lift partially opens the hooded appearance. When you inject Botox into an overactive compensating frontalis, you remove that lift and the brows drop. The hood worsens. The patient feels their eyes are smaller, heavier, and more closed. This is one of the most common complaints after poorly planned forehead Botox. The key is recognizing compensatory frontalis hyperactivity before injecting. I test this during every consultation by manually depressing the brows while asking the patient to relax completely. If the eyelid droops significantly, aggressive forehead Botox is contraindicated. At Elena Reitman MD, I use a conservative microdosing approach for patients with any degree of hooding. Lower doses, anywhere between 8 to 12 units rather than 20 units, placed higher on the forehead and further from the eyebrow line, preserves enough frontalis tone to maintain brow elevation. Strategic lateral placement can actually improve hooded eyes. Treating only the lateral frontalis and leaving the medial portion, which is in the middle, untreated, creates a subtle lateral brow lift that opens the outer eye area. Combining this approach with targeted glabellar treatment, the muscles between your brows that pull downwards, creates a net upward force on the central brow. The depressors are weakened while the elevators retain enough function. Cookie cutter Botox creates the problems you've read about. Individualized treatment planning prevents them.